Hi everybody, welcome to the Oldish TV. So happy to see you today. Spring really is coming, right? If you have not yet liked or subscribed to our Facebook page, I hope you will do that, and I hope that you will join us every Wednesday at 12 noon for our Oldish TV shows. Sign up for our newsletter. Another one just went out, and if you missed it, look on our Facebook page and you can read a copy of it and then decide for yourself if you want to sign up. We are also all over the place. Instagram, Twitter, we're everywhere. Today I want to talk to you about hospitals. There are some studies that have come out that have some immensely interesting information that I want to share with you. Now, at one point in our lives, all of us will be in a hospital, sometimes as a visitor, sometimes as a patient. Accidents happen, illnesses happen, and we need to be in the hospital. Marry that with the fact that we have often talked about falls in a community dwelling area. So people who live independently in the community, falls are a bad thing. We want to avoid those as much as possible. But guess what? They happen in hospitals or acute care facilities as well. Now, I want to be really, really clear that precious little of what I'm about to tell you is the fault of the frontline healthcare workers. The nurses, the doctors, the aides, the dietary staff, the cleaning staff, they all care beyond all measure. There simply aren't enough of them. There just aren't enough of them. Budgets have been slashed to the point where there are not enough frontline healthcare workers to care for the number of patients that are coming into hospitals. And of course, increasingly, those patients are older adults with higher needs and more risk associated with them. So let's dig into the first study here. Falls, of course, happen in acute care studies. This study came out of Western University by a graduate student who was supervised by Dr. Alexandra Zacevic, who is somebody I know quite well. It says that falls are frequent and often serious events that take place in hospitals. And interestingly enough, they say that just being in hospital is in and of itself a risk factor. Curious. Now, I would have thought that the highest number of falls would happen overnight. There's a very high number of falls that happen overnight for people who live in their own homes in the community. In hospitals, though, that turns out not to be the case. In this study, most falls happen between 10 a.m. and 12 p.m. So that was a time when they correlated that with staff being focused on multiple tasks. So they were busy doing a lot of stuff, and that's when the falls happened. In fact, it said that they were preoccupied with multiple tasks. The results of the second piece of this study showed that a change in how hospitals assess fall risk is definitely indicated. Now, we'll talk a bit more about that with the second study I'm going to talk to you about. But the third study looked at multiple cases of patient falls in the same hospital. And the findings indicated that contributing factors leading to falls were inadequate hospital policies, lack of staff education, patient cognitive and mobility issues while in hospital. And they indicated that a change in practice across all of these defense measures was recommended. Now, you know, in order to change how things are done, they really need to assign more budget. So this is not part of the study. This is my opinion. And I think that every business, no matter what kind of business you are, needs to make an assessment of how you do business these days, because the environment is changing. And one could argue that it's changing more quickly in hospitals than just about anywhere else. Patients are older, they are more frail coming into the hospital, and our priorities need to shift. That means how we do our budgets in a hospital. I mean we sort of generically. How hospitals do their budgets has to shift. It's not enough to just, at budget time, look at line items and increase it or decrease it by 1%, 2%, whatever. You need to look at what your priorities are and look at your funding model differently. Anyway, that was the first study that came from Western. The second one came from the University of Waterloo and Western University, and Dr. Zacevic was involved in this one as well, together with Dr. Susan Leet from the School of Optometry and Vision Science at Waterloo. This one was really interesting. Nearly 90% of hospitalized patients have poor vision, putting them at serious risk for falls. So we know that people fall a lot in hospitals. Now we're understanding at least one of the potential causes. This study says that falls are a significant problem and responsible for 40 to 90% of accidents in hospital. And it costs the Canadian healthcare system an additional $30,000 per patient for the severe falls. Another key finding of this study was that 100% of patients who experienced a fall during the study while in hospital had reduced vision, compared to 58% of those who did not fall. So 58% of people who did not fall also had reduced vision. Y'all need to go get your eyes checked, people. But 100% of those who did fall had reduced vision. So that is very significant. What is also significant is that it is not generally the practice of hospitals to assess vision when patients are admitted to hospital. So clearly, that is an important tool that could assess and minimize the risk of falls. Interesting. You can't just ask patients either. This study took a look at that. And if you ask them, they don't really give you their perception of the truth. We all think we're 30, right? Not so much. 89% of those who were tested confirmed vision loss, but only 30% copped to it and said, yeah, I've got some vision issues. So that's way less than half of people who did have vision loss admitting that they did. So you got to check that out. Now, another article that I found that was really interesting comes from Dr. Brian Goldman. Some of you, particularly those in Canada, will know him from White Coat Black Art on CBC Radio. He's a really interesting guy, and that's a podcast that you can listen to. And he is saying that too many seniors are staying in hospital for too long. Do you think that's true? It is absolutely the truth. Frail elderly patients are more likely to die within days of being sent home from hospital. And the Canadian Medical Association Journal is flagging that as a problem. Frailty means a patient who has diminished physical reserves. And it also means a patient who is less able to resist the physical stresses associated with illness. So let me give you, from this article, a definition of frailty so that you can assess yourself and those you love and see where they are on a high level kind of scale. Mild frailty is associated with difficulty with one or more of these tasks: shopping, preparing meals, doing housework, or handling finances. Moderate frailty is somebody who has difficulty bathing, dressing, or climbing stairs. Severe frailty is somebody who's dependent on another person to complete tasks of daily living. So that would be dressing, brushing your hair, having a bath or shower, preparing a meal, those kinds of things. If that person is dependent on someone else to get these tasks of daily living done, they are destined to be severely frail. Not destined, they are severely frail. Frailty is very common. It's very common in the community. This article indicates up to 60% of older patients living in the community are frail. It doesn't say what degree, but they are frail. And in hospitalized patients, that number ranges from 27 to 80%. So that's a pretty high number. Despite the fact that these numbers can be very high, this article is saying that doctors often fail to miss the frailty. And if they miss it, it's not being treated or dealt with. On a study that was done at the University of Alberta, they looked at 500 patients in 2 different hospitals in Alberta and found that, not surprisingly, the more frail a patient was, the more likely they were to have bad things happen. So that is actually not at all surprising. This study, this paper by Dr. Goldman, is indicating that we need to change our view of hospitals. It used to be a place where we would go to get well. It is now a place where patients are coming out with increased frailty, not getting better. Patients who are bedridden throughout their hospital stay as well get weaker and less steady on their feet. They don't eat as much, they're malnourished, they're in a strange place, there are strange noises, they're not sleeping well, they're under stress. A lot of things happen when you're in a hospital and you're not yourself. Your medications are being messed with as well. There could be side effects. And by the way, I don't mean they're being messed with in a negative way. Sometimes medications do have to be altered, and they have to find the right combination and the right strengths and so forth for the patient. Completely understand that. But it does mess with their cognitive ability, and it does mess with their balance, and it does mess with a lot of how they interact with their environment on a daily basis. One of the things that Dr. Goldman mentions in this article, which absolutely shocked me, I know it happens, but to see it in black and white shocked me. It used to be routine for older patients to have a urine catheter put in so that they didn't have to be accompanied to the bathroom, writes Dr. Goldman, so that nobody had to come and help them go to the bathroom because they're too busy. There aren't enough of them. Again, this is not the fault of the frontline healthcare staff. There are not enough of them. We now know, says Dr. Goldman, that many bladder catheters are unnecessary and harmful. He goes on to talk about strength and saying that we need to encourage seniors to walk in the hallways that were there. Now, I was at the International Federation on Aging conference back in August, and one of the speakers on one of the panels was Dr. William Reichman, who is the president and CEO of Baycrest Health Sciences. And one of the things that he said that struck me and still stays with me is that patients who are not sedated or asleep need to be gotten out of bed every 2 hours and taken for a walk. Every 2 hours. Not left in bed. Not just left in bed. So, this kind of information is really very telling. It's telling for those of us who have loved ones in the hospital that if you understand what you can pay attention to and help them with to sort of fill in the gaps. I know nobody wants to fill in the gaps. We've all been dependent on the healthcare system to just take care of business, but the money just isn't there and the patients are becoming more frail. So any time that you can get into a hospital, set aside your arguments with the bureaucracy, set aside your criticisms of them. It has to be about that patient who you love, who is in a hospital bed, and they need help. They need to be stimulated cognitively. They need to be walked. Now, if you can't safely walk them, and if they can't safely be walked, supported by you, you've got to be careful about that. But they need to be stimulated somehow. They need to do exercises in bed. They need to do whatever they can do within the level of their capability. So check that out with their doctors. They need to be encouraged to eat to keep up their strength. There are so many things that you can do for a patient who is in hospital. But according to a lot of this data, what you can also do is make sure that when they go home, that they are looked after. Because frail patients who go home, re-entry into their normal lives, don't just walk in their front door and it's back to normal. That's not the way this works. It doesn't work that way at all. They have to readjust to where they are. They're adjusting to new medications. If they have become more frail in hospital, they have to be given time and space and encouragement to regain their health. So you can do that for a patient as well. If you've got a loved one who is just recently out of hospital, you can help them to re-enter and regain their normal life by doing some of these things. The last study that I want to talk to you about is perhaps the scariest. Whether you are a patient, a visitor, somebody who works in a hospital, this is something you want to watch out for. How many of you have been in hospital and pulled a privacy curtain just to have a bit more privacy? Or the patient has said, would you mind pulling that because he's sleeping and I don't want the light to bother him? Whatever the case may be, as a healthcare professional, you might draw the curtain so you have some privacy to examine your patient. This is a little frightening. This study was done at the University of Michigan Medical Center, University Hospital in Ann Arbor, Michigan. But don't you for 1 minute think that it doesn't apply all over the place. Researchers conducted a study that collected 1,521 samples from the edges of privacy curtains, so the part that you grab, in 625 rooms in 6 skilled nursing facilities in Michigan. They also collected samples from several sites on each of the patient's bodies, as well as frequently touched surfaces in the patient's room. You want to know what they found? You might not want to know what they found, but I'm going to tell you, because if this doesn't make you go and wash your hands after watching this video even, and because you feel creepy crawly, 22% of the cultures taken from the privacy curtains tested positive for multi-drug resistant organisms. 22%. So that's more than 1 in 5. They also found 13.8% were contaminated with VRE. I cannot pronounce what VRE is, so I'm not even going to try. It's enough for me to understand that it's a bug. 6.2% were contaminated with resistant gram-negative bacilli, also known as R-GNB, and 4.9% were contaminated with MRSA. We all know what MRSA is. There is no difference in this study between private rooms and shared rooms either, so don't think that that protects you. It does not. Want to know what else they found on the patient bodies? 15.7% of the samples showed patients were colonized with the same MDRO. I think it's the wording of this. Patients are colonized. They've got it on their bodies. And they also found the patients colonized with MRSA and VRE associated with the contamination of the bedside curtains. Okay, that is incredibly creepy. And not surprisingly, the recommendations that came out of this study were very simple. Wash your hands. Everybody should wash their hands after touching patients, after touching curtains, after touching anything in the room, but before patients are touched. Wash your hands. That's how you prevent the spread of the flu virus as well. Can't help it when people cough, but washing hands is just such a simple 101 level thing to do. And as a patient, if you are concerned at all about somebody touching you and you haven't seen them wash your hands, you should ask them to go and wash their hands where you can see them. I wouldn't hesitate about that at all, because you don't want to go home with that stuff, and you don't want to get more ill because of having acquired these infections in the hospital. Additionally, this study says that hospitals should establish a cleaning frequency for the curtains and guidelines to ensure that they're kept clean and free of bacteria. Not surprising. I will go back to one of the lines from the very first study that I read you, that hospitals are not good places for seniors to be. Apparently they're not great places for anybody to be, but older adults in particular. There's all kinds of stuff going on there, from assessments for falls, from vision-related risks to bacteria. You need to be very careful and look after yourself. As I said, there's not enough money in the system these days, so it is up to each of us to look after ourselves, to advocate for ourselves. And how many times have you heard that on this program, that we need to advocate for ourselves every step of the way, and for those that we love as well. That is our show for today. I welcome all of you, as I said at the top of the show, to like us and follow us on Facebook. If you prefer Instagram or Twitter or Pinterest, we're there too, and we'll see you there. If you haven't signed up for our newsletter, please do. It comes out once a month at this point. If y'all like it, we'll do it more frequently, but right now it's once a month, but you have to sign up for it. It won't go to you unless you do that. Every day you can also go to our website, which is theoldish.com, and 6 out of 7 days you will see brand new articles related to all things having to do with aging. Until next Wednesday at 12 noon, I hope you take care of yourselves, watch out for one another, because as we often say, it takes a village to age a senior.